Okay, I call the meeting to order of the Subcommittee on Mental Health, on a Mental Health Summit. Roll call, Madam Chair, Secretary. Here. I will, is there any public comment? Anybody? So, okay. I'll take a motion to approve the minutes from our last subcommittee meeting that took place on June 17th, 2024. Okay. All right. Well, welcome everyone, and thank you for joining us today. I'm happy to report as of this morning, we have 170, it says 156, it changed, 170 guests registered for the Mental Health Summit. We've hit capacity for the morning tours, but there still is plenty of space available for the afternoon portion, which includes the Expo Fair, Patrick Kennedy's presentation, and the panel discussion. We currently have 34 registered vendors and are working on a plan to accommodate more. As a reminder, please register if you have not. Let's see. Okay, so the reason I wanted to do this meeting is initially the panel discussion was kind of focused more on like elected officials, which really doesn't get us a whole lot out of it. And fortunately, Tara Costa Howard was very gracious and said, Deb, I don't need to do that. So we do need to find, or I need to find a way to incorporate Sean Caston into this scenario, because some of you know he wanted to do his own event and kind of said, hey, let's just do this. So I think the biggest concern, and I want to hear from all of you about with the panel discussion, is I think we have an opportunity to address some of the biggest concerns that people every day are dealing with. Like my 12-year-old daughter is struggling. I don't know what to do, those types of things. So that's what I think I'd like our panel discussion to kind of focus on. There's always the stories about, like somebody's talking about suicide. I don't know, do I take it seriously? I mean, a lot of different spaces. Where do I go? What do I do? When do I do it? Who do I talk to? I think insurance and parity are important to kind of, address on this panel discussion. A lot of people don't understand what parity is. Number two, they don't understand that if they're told no, that doesn't mean they have a recourse, and people don't know that. And a lot of times that's a big barrier to care, because people just figured, okay, I can't do it, so I'm gonna not get the help I need. So I thought it would be helpful to just kind of have a discussion with everybody. I also have had a lot of people talk to me about seniors and mental health care for seniors. I would say the seniors and people with chronic or life-threatening illnesses are kind of are similar. So when you're dealing, when people are dealing with life-threatening illnesses, their mental health needs to be a priority throughout the care. It isn't always. So sometimes there are times when that mental health struggle prevents them from taking care of their physical health. So I think that's another important piece. So I just want to open it up to discussion, what you guys are thinking, the points, what you hear the most, what you think will be most helpful for the panel. And then once we come up with the questions, we'll kind of decide who we'll put on the panel. Okay, who's first? That's not helpful. Paula, I know you have a lot to say about this. If you don't raise your hand, I'm gonna. So intensive outpatient. So when you're in crisis, or so instead of being an inpatient, you would do. Oh, no.
Sorry, intensive outpatient treatment is basically, so people dealing with anxiety and it gets to a point where they just can't, either they get into the hospitalization or they're just dealing with it and they don't know what to do. I have personal experience with this, and so they go into a intensive outpatient treatment is basically a program where you go like every day for so many weeks and you meet with the counselors and you have the treatment that you need during that time, and you're in a group setting, which is really good for people with anxiety because anxiety, you don't want to talk to anybody. You literally just remove yourself, sometimes with depression also. And so it brings out and you go, I'm not alone in this. I'm literally not alone in this. And so it's a really great treatment program that I think more people need to get involved in, because I feel like there's a lot of one-on-one counseling, but not the group counseling that we need. So I think that that's something we should be focusing on.
Okay, so if we talk about intensive outpatient, we probably have to go at it from two different perspectives, right? So either somebody's been an inpatient and then they go to intent out, or sometimes they go directly to that, correct? So that would be an important thing to talk about. So Lori, what are your thoughts on that?
Oh, the little talking thing. I like the shift, I think, and I like the idea of almost like navigations through the system. So, IOP being maybe one step of it, but, yeah, if I think the crisis side is gonna be handled at the community center.
But everybody's not going to be
Oh,
there.
that's right.
Yeah.
So kind of making that link, but also maybe then having two pathways of, you don't always need to be in crisis to kind of get to that right level. So almost
That's the
kind of
important.
how
I think that's
to-
really important.
Yeah,
Yeah.
so how to navigate through both. And so, because there's lots of different levels, and I think a lot of people aren't
Right.
aware of that or how, and then kind of weaving in the insurance piece and that, it can look different, but there are resources available. So something to that effect.
Okay. And then also, I don't know, I have to think about if we have anybody with lived experience on the mental health side that would want to talk about it or not. Okay. Yep. It's supposed to be someone talking. I'm not sure that's what it looks like. Okay.
Can't see. Yes, Margaret Hernandez from Glen Ellen, who had a son, teenager, dual diagnosis. So that kind of gets that in. And I think a lot of people probably coming to this would be coming from the parents' point of view or the family member point of view. And she can talk about the struggle and how he went away to recovery, to treatment center and coming back, and the problems with the psychiatrist. So she's wonderful. Their family are really
And
wonderful
so she talks publicly
all
about
the
it.
time. And she
Oh.
teaches one of our family family classes and family support groups.
Okay.
So they talk all the time. She and her husband both.
And her
I don't know if
son's,
they're available, but they're
Yeah.
really engaging.
yeah, and her son is good with that.
Yeah. And he speaks too for us. And I forget where he's working now, but he had done a lot of part-time things for us.
Okay, that might,
But
maybe,
that would be, and a lot of people around here, and particularly in Glen Ellen, know them.
okay, okay. That sounds like a good idea. Then we're gonna need somebody to talk about parity and having, and I was hoping, Tara, that you would do that. Well, we don't have to have elected. Since I did a hearing on it and I understand it, I think you could do it quite well. I have to give you the clip notes.
And that's something too, from the hospital perspective. We can find people that can help with that as well. So I can.
Yeah, that would be great. So
Yeah.
I'd like to address it from the hospital
Yeah.
perspective as well as the law.
Yep.
Because people don't understand the law. It's important that people understand 2008, Patrick Kennedy passed the federal law on parity, and Illinois has a stronger one than the federal has. And we actually have done a hearing on it. And then the Department of Insurance fined these companies tens of thousands of dollars. And I'm just going to say Blue Cross Blue Shield was probably
Yeah.
the worst. But, and it's something that, and I can say this too, Tara, that they need to do more than just that one time. So we did a big hearing on it. And so I've talked to the chairs of the two committees in the General Assembly, and it's something they need to bring back again because it continues, as you would know better than anybody. So that's important. Okay, what else?
Well, and I agree too with the continuum of care, you know, what is the hospital and the emergency department for? What else is out there? And then from the family perspective, how do I get my loved one help? And what is that legal process? You know, that whole involuntary versus voluntary and understanding.
Well, that's the difference between a child and someone over 18, which is
Mhm.
something that is a really tough because we don't have, there isn't a lot we can do. And that is torturous. I mean, I've spent so much time with families. It's like, I don't know where my child is. They go into the, you know, into the legal system and then they are released and you don't know where they go. You don't know where they are. So that unfortunately there's been many legislators who have tried to do things about that. And it's just almost impossible because we have these groups that want to give everybody 100% right, no matter what. So
Yeah,
It's
and they
tough.
come into the emergency department with the petition filled out, thinking that that's going to ensure that they
gosh.
get admitted. That's not the process,
no,
you know, and that's really hard to explain.
yeah, well, and they can leave because we don't have locked facilities. So it's not like they can't leave at any time. So, yeah, that's another story. So I don't know how you want to address that. Go ahead.
I just think that's a really important point. And when you have an really an open community forum discussion like this, I think it's important to sort of stack the deck with your experts because people will have a little bit of a groundswell. They will be sitting there, they will be listening, and it will be their opportunity to ask their question. And again, we just find time and time again, people don't know what they don't know. And
Right.
the whole one of the concepts behind this is to educate. So I just think if we're anticipating what questions and how we can answer and how we can help address, we need to see more people from the community kind of be brave and step forward and ask their questions, because I just think
Well, and that's a really good point, Karen, because what I want the panel to do is just give kind of an overview of the issues, but then I want to have enough time for audience members to ask questions. So that's going to be really important too, because there are people that are going to be there that really just, you know, they're the ones with the 12-year-olds and they don't know what to do. And so hearing from them, I think is more important than us creating a scenario. So we want to give them the facts and the tools. And then we want to hear what, you know, what their personal struggles are. Anybody else? Mr. Berlin.
I think we need to provide, if not a list, at least talk about all the resources that are out there. Because I think there's a huge lack of understanding of who to call. Where do I go? And I agree the legal process is very important. Because it's confusing for a lot of people.
Yep. So Jenna is putting together a brochure. So everybody that participates, Tara and I did this at the state level at one point. And so she's going to put together a brochure for all the vendors that come and all the resources. And then Lori, obviously she was going to work with you guys on it and make sure, like, there may be people that aren't here that we should put in there. So just making sure, I mean, it's a point, an opportunity point where we can get these in people's hands. So the other thing I wanted you guys to know is that Patrick Kennedy is more of a diva than I realized, but probably shouldn't have said that on record. Anyways, but a fabulous, he's an amazing person. He is, but he does not take pictures. So he will do kind of a VIP reception type thing. So in terms of that, if you're registered and, you know, on the board, we can put you on that list so you can actually meet him, get a picture with him. Some of you guys may or may not have books. If you want him to sign them, he'll sign them, but he won't do any of that outside of that scenario. So we're just going to extend that to DCSS members, to county board members, and then also to health department board members, and see how many people we have. And you know, it's an invite only, unfortunately, because it just isn't going to work any other way. So if you guys have somebody that you think would be, you know, let me know and we can certainly work around it. But that piece of it will be a little bit interesting. Jenna, do you want to talk about the buses a little bit?
So for the morning portion, we're doing the tours. We're calling them experiences because it's not like they're necessarily getting walked around from room to room. But once they check in the morning, they will be immediately directed to a bus. We have 2 buses that will hold about 100, and then we are going to accommodate the remaining. I think our capacity is 120, so we will accommodate the remaining 20 just to avoid, so they don't have to walk in that. Yeah. So the buses will then take them to the community center and then also to the courthouse. There will be 2 separate. They will go in for their presentations and then they will switch. And then the buses will drop them back off right at the entrance of the administrative building so that they can come right in and enter into the expo fair. So 2 buses plus we will have other accommodations for the remainder. Those are just not exactly set in stone, but in the process.
And again, if you want to be in the reception with Kennedy, you have to register and you have to let us know because they do a background check on you. So if you've done anything, might as well let Bob know now. So, and Bob, I would ask you, who would be the best? Do you want to do it? The panel discussion about the legal piece of it? Or is there like a, I don't know, Marchese, what's your thoughts?
If there's a way to have both,
Well-
it would be good to have
Okay,
either myself, somebody from my office,
yeah,
probably me. But I think it's important to have somebody from the judiciary.
well, we have, yeah, because Marchese is doing the tours. So yeah, we'll figure that one out. But yeah, okay.
So then maybe we get one of the civil judges who are handling.
Yeah.
Hearings.
That makes sense. I think because people want to probably know what that process really looks like.
I would also
Sure.
suggest having Jeff York from the Public Defender's Office, because you should always have both sides of an issue when it's the legality of something.
Well, I don't know though, because that's kind of like you can't really, like, we're explaining to people. I think maybe one person can do both. Because the
I
panel's gonna
wouldn't
be
do that.
awfully
I
big.
just, Bob, I don't know, you tell me if I'm wrong, but I don't think you should ever have one person explain both the state side and the defense side of an issue. I mean, if Marchese's going to talk about it or somebody who's doing that, I
think what we're trying to do is get the information to people about what do you do if you want to do this for your adult person. Like I have no idea. Like if I want to get custody or whatever conservatorship, whatever it's called, of my adult child, what do I do? How do I do that? Like, and I think that's the most important piece of it. And then also they can say, and then of course they would be, how Jeff would be involved in it as well, because it's not just, you can't just go fill it out and get it. So I don't want to have too many people on the panel because it'll be too hard.
That part, I totally
Yeah.
agree with you. I just, from a legal perspective, I understand what the goal is, but as people, it's very hard to explain to a parent when you get the call, but your child still has rights and they legally
But this
are
isn't about a
entitled-
child. This is about an adult.
No. They have rights. Again,
Yes.
I'm just,
It's
but
very,
that's fine.
Yeah.
I would do what you want.
but it's in Bob, can you
That's-
answer? It's very difficult to get one, isn't it?
To get,
To get conservatorship or whatever, I don't know the right term, over an adult child for mental health issues.
that's not my area of expertise.
Okay, I think
honestly.
it's, I don't know if anybody else in the room has any experience or understands it, but my understanding from people who have done it themselves is that it's very, very difficult to get.
And you might be talking about civil commitments too. So it will be civil as compared to.
Civil commitments, right, different issue.
So we should probably talk about that as well.
Yeah.
Talk about both. Yeah, because people don't understand. I have a very dear friend who just had to go through that with his adult son, and his son was, he was in school to become a psychiatrist. And now, unfortunately, lives with his parents and they have conservatorship or whatever the word is over him and his, decision making, medical as well as, financial, because
But I think just the regular person's understanding of, what is that process with a petition and the cert
Yep.
and why can't I do that for substance abuse? Why is that voluntary? Or
Right.
things like that.
yeah, that's
It's
a good
whole
point too.
process.
Yeah, very good point. So we need somebody who can address all those issues. Paula?
And that's what I was gonna say. I've had a constituent get a hold of me whose son is an adult. And because of his issues, he was using some substance and ended up getting a DUI because of it, because went into his car. Anyways, so I don't know if we do need someone there explain how to then get them into the mental health court versus that's what I was
So-
trying to explain the whole process and I
Yeah,
don't know at
And
all.
I'm
so-
trying to figure out, so they're in the tour, they're gonna address all that stuff.
Okay.
So I don't know, if there's a way that we can address that for the rest of the crowd. 'Cause there's only so much capacity we're gonna have on the panel. And obviously we want to give them as much possible information as we can. So maybe there's a way to put something in the brochure or something about stuff like that. So yeah, let's talk about that a little bit more after the meeting. Anybody else? Anything anybody can think of? I know,
Insurance. Did we?
well,
talk
that's
about insurance?
parity.
Parity. Oh,
Parity is insurance, yeah. It's insurance. Yeah, and parity, anybody in the mental health or addiction space needs to know the word parity because it's gotten better, but it's nowhere near where it should be. And, I hate to say it, but insurance companies they'll deny you. And how many, maybe 1 out of 10 will come back. And that's what they count on.
I just want to add to, I think for the panel is, making sure they're kind of keeping it at that overview. I think this is so complex and it can get spiraled very quickly
Mhm.
into a lot of details that I think
Right.
the panel is only going to have a certain amount
Right.
of time. So
Yep.
making sure they then have access to, like, okay, if I have more questions, maybe it's that list of like, who can I contact after this? Because the questions are probably going to get pretty specific.
Yeah, and I think when the audience asks questions too, they're gonna get much more specific. So that's why it's like kind of figuring out what we should cover generally that will probably where the areas where the questions are gonna come in, so to speak. And then go from there. And I'm sure we're not gonna have time to answer everybody's questions, unfortunately. But we will make sure we figure out how each one of those people gets a connection that they need to get their answers. Anybody else? Anybody have any new business? Anybody have any old business, new business, old business? Okay, sir.
Can I just ask a question? I mean, do we have a set agenda? As to,
Mhm.
we're gonna be doing tours in the morning, is that? all?
Yeah, Jenna just she can go through it again.
Yeah, so just the tours will be happening in the morning. Those will run from 9 to 11. Then from 11 to 12 will be the expo fair. And then participants will also be given a boxed lunch during that time. And then from 12 to 1 will be Patrick Kennedy's presentation. And then 1 to 2 is the panel. And then the day concludes at 2.
And Jenna, what time were we gonna do that, the reception with?
I believe prior to the expo fair. So he's arriving, I think, 45 minutes to an hour earlier than his set.
So it'd
visit.
probably around 11 o'clock.
Yes. I think, Mila, do you agree?
That makes sense. That makes sense. Anybody else?
Can you sign up for just the afternoon? Because I checked, I've already registered myself, but I went to the registration this morning and it said full. You can't register.
Yes, you can, the The morning portion is full, unfortunately, but yes, you still have the option to register for the afternoon.
So I just need to scroll down. further?
Yes.
We probably,
Okay.
Jenna, is there any way to put something on there? Because I don't want people to think that it's full. Like if they go to that and see it's full, they don't realize it's just for the tour and not for the event.
Sure.
So
I,
just,
I think there might be, I'll look and double check, but yes, we
Yeah.
can add whatever we need to.
just make sure
it's
that's clear. Just say, you know, tour is full, but, you know, the event is still room for that. Okay, so, and you know, if anybody thinks of anything, I'm sure whoever our panelists are will be able to do this. So it's most important to me that we have the right people on the panel that can kind of field these questions, give some kind of overview of the issues that we hear the most. And addiction too, we're gonna have to talk about that. We haven't really talked about that much, but I think that's, you know, really important. Education, how do you talk to your kids? Those types of things are really important. So, you know, reach out. We still have some time. I'm sure whoever's going to be on the panel will be able to, you know, if you guys feel really strongly about something, please let me know. Make sure that we get that covered. And thank you guys, everybody, for this. I think it's going to be a great event. Very excited about it. So I guess we're adjourned until we're not. No, we're